What if I told you that the way most older men approach masturbation may actually be silently damaging their health in ways they've never imagined? It sounds hard to believe, but it's something I've witnessed for decades in my clinic. Today, I'm going to share with you 6 important medical truths about masturbation and aging, facts that could completely change how you understand men's health after 60. According to the American Urological Association, sexual health is an essential part of overall health throughout a man's entire life. And yet, sadly, it's the most neglected aspect once men reach older age. This neglect is why millions of men end up struggling with erectile dysfunction, declining testosterone, and even cardiovascular disease or prostate cancer, conditions that in many cases could have been prevented. My name is Dr. Benjamin Hartwell. I'm a physician specializing in men's health with more than 30 years of experience working with men your age. I'm not here to shame you. I'm here to show you that your body still has the ability to recover and thrive if you know how to listen to the signals it's giving you. And I want you to engage with me right from the start. If this is the first time you've ever heard a doctor openly connect masturbation with health, drop a 1 in the comments. If you already knew a little about this topic, drop a 0. Your feedback will help me create even more practical content for men over 60. So let's dive into the very first truth, where erectile dysfunction isn't just about the bedroom, but can actually serve as an early warning sign for your heart. Secret number 1, erectile dysfunction is an early warning sign of heart disease. I still clearly remember Thomas, a 68-year-old man who came into my office looking frustrated. He sighed and said, "Doctor, maybe I'm just getting old. I just don't have the strength I used to." But when we ran his tests, the truth came out. His coronary arteries were severely narrowed, and just a few months later, he suffered a heart attack. The striking part, his erectile dysfunction had started 3 years earlier, but both he and his previous doctors ignored that signal. Major studies have proven that erectile dysfunction in middle-aged and older men is not just a bedroom problem. It's a vascular warning sign, especially for the heart. The Princeton Consensus Panel reported that men with erectile dysfunction are 2 to 3 times more likely to experience a cardiovascular event than men without it. The reason is simple. The blood vessels in the penis are much smaller than coronary arteries. They get damaged first, show up as erectile issues, and only years later does the damage reveal itself in the heart. In other words, every time you struggle with persistent erectile problems, your body may be sending you an SOS signal. Check your heart right now. This isn't speculation, it's globally recognized medical evidence. So if you've noticed that things aren't what they used to be, don't just reach for quick fix pills. See it as an opportunity to get a full checkup, blood pressure, blood sugar, cholesterol, and most importantly, your heart health. Because sometimes saving your heart starts with listening to your body. Now, once men recognize this connection, many make the opposite mistake. They think the best way to protect themselves is to completely give up sexual activity. But the next truth might surprise you. Secret number 2, quitting completely after 60 may increase your risk of prostate cancer. After I explain that erectile dysfunction can be a warning sign for heart disease, many patients ask me, "So, doctor, does that mean I should stop sex completely after 60 to be safe?" This is one of the most common myths I hear from older men. They believe that by conserving energy and avoiding sexual activity, they're protecting their health. But science shows the exact opposite. An 18-year Harvard School of Public Health study tracking over 29,000 men found something shocking. Men who ejaculated regularly, around 21 times per month, had a 33% lower risk of prostate cancer compared to those who ejaculated only 4 to 7 times monthly. And this applied not just to sexual intercourse, but also to masturbation. Why? When the prostate isn't regularly cleared, secretions can build up, creating an environment that encourages inflammation and bacterial growth. On the other hand, regular ejaculation helps flush out the prostate, reducing blockages and infection risk. Reputable organizations like the American Cancer Society and the WHO recognize this as a natural protective mechanism. I've seen patients who believed abstinence was the healthiest choice, but when they resumed a balanced, regular sexual routine, not only did their quality of life improve, but their prostate test results stabilized as well. The key is to see sexual activity not just as pleasure, but as preventive medicine. But even if you keep this healthy routine, there's still a silent enemy that can harm your brain and destroy your sexual function, and it's present in almost every modern household. That enemy is pornography. Secret number 3. The dangers of pornography on the brain and sexual function. One afternoon, I met David, a 72-year-old, who admitted, "Doctor, I don't feel any desire for my wife anymore, but strangely enough, when I watch porn, I still react." It may sound harmless, but in reality, this is one of the most dangerous underestimated threats to older men's health. Our brains are wired to respond to natural signals, touch, emotion, intimacy. But with frequent exposure to pornography, the brain becomes flooded with dopamine surges, 200 to 400% stronger than what real sexual intimacy produces. Studies from Cambridge University show that in men over 60, this overstimulation leads to impaired working memory, slower processing speed, and poor self-control, the exact same cognitive functions that decline first in Alzheimer's disease. Even worse, brain scans of men who had used porn for years showed gray matter shrinkage and weakened neural pathways, almost identical to the brains of patients in the early stages of dementia. This explains why so many men think they have erectile dysfunction, when in fact they're dealing with porn-induced ED, a completely different condition, but one that can be prevented. I often tell my patients, it's not that your body is broken, it's that your brain has been rewired the wrong way. The good news is, when they stop depending on pornography and return to healthier experiences, many men see remarkable recovery, both in their sexual function and in their mental clarity. And that brings us to the next secret, because beyond protecting your brain, a balanced, healthy sex life is also a natural key to maintaining testosterone, the hormone most men assume is gone forever after 60. Secret number 4. Masturbation helps maintain testosterone, the hormone of strength and vitality. Many men over 60 come into my office convinced, "Doctor, testosterone decline is just natural. Nobody can avoid it." But the truth is, testosterone doesn't just vanish the way many believe. In many cases, the way you maintain or abandon sexual activity is the real deciding factor. A study from the University of Pennsylvania followed more than 2,400 men ages 65 to 85 for 7 years. It found that men who maintained sexual activity at least twice per week had testosterone levels comparable to men 10 to 15 years younger. In other words, simply sustaining a healthy sex life can help slow down your biological clock. I once treated Richard, a 70-year-old man who complained of constant fatigue, joint pain, and loss of muscle strength. His testosterone was under 280 nanograms per deciliter, below the healthy range. Instead of rushing to prescribe medication, we started with a simple plan: maintain moderate sexual activity and reduce stress. Just 2 months later, his testosterone had risen by more than 30%. His sleep and mood improved, and he even started going back to the gym. The key thing to remember, testosterone doesn't just influence sexual performance. It directly impacts cardiovascular health, bone density, muscle mass, memory, and even mood. Men with testosterone levels below 300 nanograms per deciliter face double the mortality risk compared to men in the normal range, according to the Mayo Clinic. So don't assume age means you have to live without your male hormone. Your body can still produce testosterone as long as you maintain a healthy connection with yourself. But testosterone alone isn't enough. Even if your hormones are restored, your blood vessels still need another natural medicine to keep erections and vitality strong. And that's movement and weight control. Secret number 5, exercise and weight control, the natural medicine for penile blood vessels. After decades of practice, I've learned there's no drug more powerful than your lifestyle. One longtime patient of mine, James, 66, suffered from severe erectile dysfunction along with type 2 diabetes. He had tried medication, but the results were only temporary. When we shifted focus to weight loss and consistent exercise, within 6 months, not only had his blood sugar stabilized, but his sexual function had also improved dramatically. Science confirms this. A meta-analysis of randomized clinical trials showed that men who exercised 150 to 300 minutes of aerobic activity weekly, plus 2 to 3 strength training sessions, significantly improved their erectile function scores, IFEF, compared to those who didn't exercise. On top of that, large cohort studies show that men who follow a Mediterranean diet, rich in vegetables, fish, olive oil, nuts, and whole grains, have much lower rates of erectile dysfunction than those who eat diets high in red meat and processed foods. What's more, losing just 5 to 10% of body weight in overweight men can noticeably improve erectile function within a few months. That's because ED is essentially a small vessel disease. The tiny arteries in the penis are the first to show damage from obesity, diabetes, or high cholesterol. I often tell my patients, every step you take on the treadmill, every healthy meal you choose today, that's a prescription for your manhood tomorrow. This isn't theory. It's proven truth, seen in thousands of men in their 60s, 70s, and even 80s. But here's the catch. All of these physical efforts can be undone if your mind still carries a silent burden that destroys health from the inside, sexual shame and guilt. And that leads us to the final secret. Secret number 6, sexual shame and guilt, the silent burden destroying men's health. One of the deepest pains I see in older men isn't disease, it's shame. Robert, 70, once admitted to me, "Doctor, I feel guilty whenever I still have desire. At my age, I should have let it go by now." That feeling of guilt made him withdraw, grow quiet, and lose connection with his family. And this doesn't just stay emotional. Data from the U.S. National Institute of Mental Health shows that men who suppress sexual desire out of shame face a 340% higher risk of depression, 280% higher risk of anxiety, and 450% higher risk of social isolation compared to men with a healthy attitude toward sexuality. Studies from the American Psychological Association also show that sexual shame raises the risk of cardiovascular disease, immune dysfunction, and even premature death. The opposite, however, is just as powerful. When patients overcome this shame, the results are astonishing. Blood pressure stabilizes, sleep deepens, depression eases, and memory improves. I've seen many men like Robert regain confidence, rebuild intimacy with their families, and most importantly, rediscover joy in life after years of believing it was gone. I often remind them, your body hasn't betrayed you. Shame is what's been killing you from the inside. When you allow yourself to accept that desire is natural, not dirty, you open the door to healing, both physically and emotionally. And that's exactly why, in this conclusion, I want to revisit these 6 vital secrets, not just so you remember them, but so you can turn them into real action and start transforming your life today. We've just gone through 6 life-saving truths that most men over 60 have never heard explained so clearly. First, erectile dysfunction isn't just about the bedroom, it's an early warning sign for your heart. Second, giving up sex completely after 60 doesn't protect you, it actually increases your risk of prostate cancer. Third, pornography isn't harmless. It can damage your brain and destroy your sexual function. Fourth, maintaining moderate sexual activity is the most natural way to preserve testosterone, the foundation for strength, bone health, muscle, and memory. Fifth, exercise and weight control are the natural medicine that nourish the blood vessels in your penis and your entire cardiovascular system. And finally, overcoming sexual shame and guilt is the true key to healing, physically and emotionally. I know some of these may have surprised you, maybe even left you a little uncomfortable. But remember, sexual health is nothing to be ashamed of. It's an essential part of your overall health. Your body still has the ability to recover as long as you listen and take action at the right time. Now, I'd love to hear from you. If one of these 6 secrets really surprised you today, leave a comment with the number 1. If you already knew at least some of these truths, leave a 0. Your feedback helps me create even more valuable content for the community of men over 60. Don't forget to hit subscribe and turn on the notification bell so you don't miss the important medical insights that could extend both your lifespan and your quality of life. And if you think this video could help someone you know, share it, because you might be the one who saves them from a serious health crisis. I'm Dr. Benjamin Hartwell, and I'm grateful you spent this time with me today. Remember, your health is your responsibility, but you never have to walk this journey alone. We're a community, and I'm here to walk it with you. I'll see you in the next video, where I'll continue sharing the truths few dare to say, but that just might save your life.